Ever wondered how risk management plays a pivotal role in bone marrow transplantation, commonly known as BMT? Welcome and prepare to embark on an enlightening journey about this critical aspect of healthcare. Imagine this scenario. A patient, let's call him John, has been diagnosed with leukemia, a type of cancer that affects the blood and bone marrow. John's doctors have decided that a bone marrow transplant is his best chance for survival. But this procedure isn't without its risks. In BMT, the patient's diseased marrow is replaced with healthy marrow from a donor. But here's where the risk management comes in. Two main risks are involved: the risk of the patient's body rejecting the new marrow and the risk of the patient developing infections due to a weakened immune system. John's healthcare team, therefore, needs to meticulously manage these risks. They start by finding the most compatible donor. They use a process called HLA typing, which matches the patient and donor based on certain proteins in their cells. This reduces the risk of rejection. Next, they need to manage the risk of infection. To do this, John is placed in isolation after the transplant to protect him from harmful germs. His healthcare team also monitors him closely for signs of infection and provides preventive antibiotics. In addition, John's team educates him about the importance of following strict hygiene practices and maintaining a healthy diet to help boost his immune system. This is a crucial step in managing the risk of infection post-transplant. Now, let's circle back to our question about the role of risk management in BMT. In John's case, the principles of risk management were applied in identifying potential risks, rejection and infection, and implementing strategies, HLA typing, isolation, prevention, and education to mitigate these risks. To summarize, risk management in BMT involves identifying potential risks and implementing strategies to mitigate these risks. In our case study, the risks of rejection and infection were managed through donor compatibility testing, patient isolation, preventive medication, and patient education. Remember, the goal of risk management in BMT is not to eliminate risks completely. That's usually impossible. The goal is to reduce the risks to an acceptable level to increase the chances of a successful transplant. And that, my friends, is a glimpse into the complex world of risk management in bone marrow transplantation. It's a delicate balancing act, but with careful planning and management, we can tip the scales in favor of successful outcomes. Until next time, stay curious and keep learning.